Hello dear students, welcome back to our GDC weekly test explanation. I hope you already know that this is nothing but this week we are going to discuss MCQs on autonomic nervous system along with their explanation. I hope you already gone to the exam, you attended the GDC weekly test on autonomic nervous system. So you done well and definitely this explanation will help you to know more detail why this answer is only why remaining three options are incorrect like that. Okay. So once again, welcome to GDC English on topic autonomic nervous system and welcome to GDC English classes YouTube channel. So whatever it may be in the competitive scenario to succeed in the competitive exams like GPAT, NIPER, drug inspector and pharmacist, you know that once you gone through the GPAT, definitely you can easily enter into the NIPER examination as well as you can easily crack the pharmacist as well as drug inspector. And especially to succeed in the competitive examination, solving the MCQs, practicing the MCQs along with explanation boost your memory as well as boost your confidence. So both are the two ingredients essential to succeed in the competitive examination. So without any delay, we will start discussion regarding the first MCQ of autonomic nervous system. So whatever it may be, you know that autonomic nervous system is nothing but ANS, nothing but autonomic nervous system. It is involuntary in nature. It regulates sympathetic, parasympathetic as well as enteric nervous system functions. Okay. So let's have it start our discussion with the first MCQ. So what is the first MCQ here? Just a minute. Okay. So here, which of the following statement? Which of the following statement about neurotransmitter in the autonomic nervous system is true? So regarding the this autonomic nervous system, so which of the following are correct? So first option, the major neurotransmitter in the sympathetic division is noradrenaline. Okay, generally adrenaline as well as noradrenaline. The parasympathetic division uses acetylcholine as its major neurotransmitter. Yes, that is correct. And third one, dopamine is minor neurotransmitter in the parasympathetic division. So generally, acetylcholine is a major. Already that is correct regarding the sympathetic nervous system as a neurotransmitter. And even there is involvement of a minor role of nitric oxide, a potent vasodilator on the smooth muscle regarding the blood vessel. And VIP, vasoactive intestinal and nitric oxide are minor neurotransmitters in the parasympathetic division. I hope you know that yes, option S is correct regarding VIP, vasoactive intestinal peptide and nitric oxide having minor role as a neurotransmitter in parasympathetic nervous system. Dopamine is not involving in the parasympathetic nervous system. That is wrong. And the parasympathetic division mainly involved by acetylcholine. That is correct. And the major neurotransmitter in the sympathetic division is not along with the adrenaline. So simply the wrong one is the R. The wrong one is the R. And PQS are correct. PQS. If you observe the options, it is mentioned here clearly. PQS. Option B is the right answer for this question because here they mention in the option R. Dopamine is a minor transmitter in the parasympathetic division. So dopamine is a minor neurotransmitter in the sympathetic division. So answer is the option B. And next. Just a minute. I think some unfortunate thing is happened here. Nothing is there. Regret for small inconvenience. I think there is some technical issue in the panel itself. So here, this is some essential introduction regarding the explanation of first MCQ. So regarding sympathetic, parasympathetic, how they are related. So what are the important points regarding the structural organization according to the autonomic nervous system basics. And moving to the next MCQ. Regarding type 1 muscarinic. I hope you know that muscarinic receptors comes under the parasympathetic nervous system, especially cholinergic system. So regarding M1 receptors belongs to 𝘎𝙀𝙁𝘋𝙀 receptors, and this M1 receptors are linked with IP3 DAC pathway regarding signal transduction. So regarding type 1 muscarinic receptors, consider the following statement. So M1 receptors located in autonomic ganglia as well as gastric glands. As they are located in the gastric glands, type 1 muscarinic receptor activation leads to decrease in intestinal secretion. For example, especially this M1 receptor present in the glands, stimulation of intestinal glands leads to increased secretion. So M1 receptors are muscarinic receptor, 𝘎𝑡𝐿 bind to type 1 muscarinic receptor, that leads to increasing secretion. But here activation leads to decreasing secretion, that is wrong. They are a GQ protein coupled receptor. When there is activation of 𝘎𝛼𝑞 due to activation of M1 receptor, it linked with the IP3 DAC pathway. IP3 DAC pathway leads to increase in calcium. Increase in calcium helps in releasing of secretions from the glands. And MCN343A and oxytremorin are M1 receptor agonists. So here clearly option Q is incorrect. Generally, it leads to increase in release of secretions. So remove the Q. Q is wrong. So Q is here, and all of the above no, because Q is wrong. So P R and PRS are correct. So regarding M1 muscarinic receptor, consider the following statement, that is true statements. So option Q is the wrong one. So answer is simply PRS only answer. And this is regarding the M1 receptors. So its location, what is the effect, and the important drugs, and along with M2, M3 receptors also. So if you want to in detail, so you can go for the pause the video and go for the explanation in detail. Next, which are the following statement? Going to the third MCQ. Which following statement correctly matches agonist or antagonist with their respect to nicotinic receptor supply? So here matching with the drug along with the receptor, maybe agonist or antagonist, and especially on the nicotinic receptor. Nicotinic receptors also comes under parasympathetic or cholinergic system. Nicotinic receptors are ion channel receptors. Two types of nicotinic receptor, NM, nicotinic ganglion type, nicotinic muscle type. So DMPP, DMPP is a selective agonist for NM receptor. PTMA is a selective agonist for NM receptor. Tubocurarine, it blocks NM receptors. Hexamethonium acts as an NM antagonist. Generally, hexamethonium, always onium, quaternary ammonium compound. Most of the neuromuscular blockers as well as ganglionic blockers are quaternary ammonium compounds. Quaternary ammonium compounds are cationic in nature, they are polar in nature, having poor absorption and distribution in the body fluids. So, generally, hexamethonium is a ganglionic blocker. It does not act on the NM receptor. It acts on the NM receptor. So, remove the S generally. So, here S is there, remove that, and they given P and Q only. Generally, PQR. So DMPP is a selective agonist for NM receptor. PTMA also selective agonist for NM receptors. And tubocurarine also blocks NM receptors. The simple answer is the option S is incorrect. Option S is incorrect. PQR is the correct. Okay. Next MCQ. Match the following types of anticholinesterases with their example types. Match the following types of anticholinesterases with their following examples. So reversible carbamates. So carbamates, I hope you know that acetate CH3COO, carbamate NH2COO. Because of the carbamates, particular drug having long half-life due to less hydrolysis in front of 𝘿𝑄 enzyme. But 𝘿𝑄 containing acetate ester group. Because of that ester group, 𝘿𝑄 undergo rapid hydrolysis, short half-life, not suitable through oral route of administration. But carbamates like carbachol, physostigmine, neostigmine, they having carbamate in their structure. Carbamates are not easily hydrolyzable like 𝘿𝑄. So carbamates are having long half-life. Okay. So reversible carbamates. Reversible carbamates nothing but here, for example, neostigmine. And reversible non-carbamates. Reversible non-carbamates will be goes to the hydrophonium. And irreversible carbamates. Irreversible carbamate will goes to here. And irreversible organophosphorus compound like propoxer. So here you can see the reversible carbamates, neostigmine, and reversible non-carbamates. So first you can observe. So P is 2. So P is 2 is already present here. So option A is there, option D is there. And coming to reversible non-carbamates. So reversible non-carbamates like so Q is 1 and even P2 Q1 is present in the option A. And irreversible carbamates is a propoxer and irreversible organophosphorus is a diazinon. So the answer is simply so option A. So that is reversible carbamates, neostigmine, reversible carbamates, neostigmine, and reversible non-carbamates, hydrophonic, a diagnostic agent for treatment of myasthenia gravis, and R3, irreversible carbamates, propoxer, and S4, irreversible organophosphorus compound, diazinon. The answer is option A. Answer is option A. So here it is the explanation with the classification. So organophosphorus compounds, carbamates, both. So irreversible. These irreversible drugs are inhibit the acetylcholine esterase enzyme by forming covalent bond. Irreversible. And this category reversible, they inhibit the acetylcholine esterase enzyme by forming weak forces like van der Waals forces or hydrogen bonding. Next. Match the following anticholinergic drugs. Match the following anticholinergic drugs with their class. So scopolamine. So scopolamine generally a natural alkaloid. Scopolamine is generally a natural alkaloid. Next, homatropin. Homatropin generally semi-synthetic derivative. Homatropin generally semi-synthetic derivative. Solifenacin, vasoselective, selectively acts on the urinary bladder, relax the urinary bladder, and helps to control overactive urinary bladder. And remaining one, procyclidine is a drug helps in the treatment of anti-Parkinsonism. So all these are anticholinergics. They block muscarinic receptor. Anticholinergics helps in the treatment of Parkinsonism. So yes, scopolamine natural alkaloid like atropine, and homatropin semi-synthetic, solifenacin vasoselective directly block type 3 muscarinic receptors on urinary bladder and reduces excess or overfunction of urinary bladder, and procyclidine drug of choice for treatment of Parkinsonism. So the answer is simply option D. So here answer is option D. Option D, P2 scopolamine and Q4 homatropin semi-synthetic derivative and R1 vasoselective and S nothing but S3, that is anti-Parkinson drug. Answer is option D. So this is a clear classification of anticholinergic drugs. They block muscarinic receptors. So like natural alkaloids, semi-synthetic, synthetic compounds along with their clinical applications. Next. Which of the following statement regarding neostigmine are true? So neostigmine generally a reversible anticholine esterase. It is a reversible anticholine esterase. It inhibits the acetylcholine esterase enzyme reversible manner. and it is a quaternary ammonium compound, have poor absorption distribution, having less penetration ability into the placental barrier as well as a blood-brain barrier. And neostigmine can be a drug of choice for myasthenia gravis. So let's see the options one by one. Neostigmine is a synthetic quaternary ammonium compound, poorly absorbed from the gut. It crosses the blood-brain barrier, unable to cross the blood-brain barrier, not cross the blood-brain barrier. It is a quaternary ammonium compound, correct? Yes, poorly absorbed from the gut, correct? And cross the blood-brain barrier, unable to cross the blood-brain barrier. Neostigmine enhances skeletal muscle strength and the force of the contraction myasthenia gravis. Yes. And one of the property, neostigmine can stimulate. Neostigmine not only inhibiting acetylcholinesterase enzyme, it can also stimulate NM receptors, may produce contractions in the myasthenia gravis. Myasthenia gravis muscle weakness, but neostigmine stimulates skeletal muscle, may make the inactive muscle to little bit active muscle. Used in myasthenia gravis, post-operative paralytic ileus, and also atony of urinary bladder. And its duration of action is 6 to 24 hours. Its duration of action is 6 to 24 hours. So generally, it is a drug treatment of myasthenia gravis, and it is helps in the treatment of myasthenia gravis as well as atony of urinary bladder. And clearly, you can observe here it does not cross the blood-brain barrier. As I mentioned, neostigmine is a quaternary ammonium compound. Quaternary ammonium compounds are polar nature. Polar compounds cannot cross the blood-brain barrier easily. What here they mention, it crosses the blood-brain barrier, but neostigmine can cross the blood-brain barrier because it is a polar nature. It is a quaternary ammonium compound. Okay. So this is the difference between physostigmine and neostigmine. Physostigmine natural alkaline, neostigmine synthetic. Physostigmine tertiary amine. Tertiary amine can cross the blood-brain barrier. Neostigmine quaternary amine unable to cross the blood-brain barrier. Next, see the next MCQ. Regarding the next MCQ, which of the following pair is incorrectly matched? So clonidine select to alpha 2 receptor agonist as a antihypertensive. Yohimbine select to alpha 2 receptor blocker but not beta 2 receptor antagonist. Salbutamol select to beta 2 receptor agonist, helps in the treatment of asthma. Atenolol select to beta 1 receptor blocker. S. So I hope you clearly understand. Yohimbine is also one of the natural alkaloid. Yohimbine select to alpha 2 receptor blocker but not beta 2 receptor blocker. So beta 2 receptor stimulation helps in treatment of asthma, but beta 2 receptor blocking or antagonism increase the risk of asthma. Answer is very simple, you understand already. Option B is the not correct way because yohimbine is a selective alpha 2 receptor blocker but not beta 2 receptor blocker. Blocking of beta receptor may increase the risk of asthma. Okay, so let's see the next MCQ. Which of the following cholinesterase inhibitors has the longest duration of action used in Alzheimer's disease? So physostigmine, donepezil, edrophonium, neostigmine. So among the drugs, which one is commonly used? So generally neostigmine mainly for myasthenia gravis, edrophonium as a diagnostic agent, and physostigmine also prefer. But regarding the longest acting, generally that will goes to the, so that is donepezil. So donepezil is the drug helps in the treatment of Alzheimer's disease. It having long duration of action, and especially cholinesterase inhibitors. They inhibit the acetylcholinesterase enzyme. Because of inhibition of acetylcholinesterase enzyme, there is a no metabolism of acetylcholine, leads to increasing levels of acetylcholine. This increasing levels of acetylcholine essential in treatment of Alzheimer's because in Alzheimer's disease there is a decreasing acetylcholine levels in the brain as well as decreasing cholinergic transmission in the brain. Okay, so you can see the question once. Which of the following cholinesterase inhibitor has longest duration of action and used in Alzheimer's disease? That is donepezil. So here, so drugs helps in the treatment of Alzheimer's disease, also known as memory enhancers. The other term for memory enhancers is nootropics. Nootropics also memory enhancers. Memory enhancers. Next. Just a minute. So really regret myself due to small inconvenience. So kindly understand from your side. So next question. Which one of the following drug is most likely to cause tachycardia due to inhibition of vagal M2 activity in the heart? So, which of the following drug may cause tachycardia, increasing heart rate by blocking M2 receptor? Generally, stimulation or agonism of M2 receptors on heart causes cardiac muscle relaxation, produces bradycardia, decrease in number of beats. But here, blocking of M2 receptors, agonism of M2 receptors, cardiac muscle relaxation. Blocking or antagonism of M2 receptors may lead to tachycardia. But how the tachycardia? So the drug atropine, propranolol, pilocarpine, 𝙂𝙄𝙎𝑃𝑖𝑛. 𝙂𝙄𝙎𝑃𝑖𝑛 is a acetylcholine esterase enzyme inhibitor. Increase the levels of acetylcholine. If acetylcholine increases on heart, cardiac muscle relaxation. No. Pilocarpine is a myotic, causes constriction of pupil of eye. And propranolol is a non-selective beta blocker, acts on beta adrenergic receptor. And atropine is a parasympatholitic, blocks muscarinic receptor. Atropine block type 2 muscarinic receptors on heart and causes tachycardia by causing cardiac muscle contraction. So acetylcholine parasympathomimetic, atropine is a parasympatholitic. Very easy. So easy to understand. Answer is atropine. Yes. Vagus. When vagus nerve innervated on heart, it releases acetylcholine. But acetylcholine causes cardiac muscle relaxation. But atropine block vagal M2 receptors on heart causes cardiac muscle contraction, increases heart rate, tachycardia. Next. Which muscarinic receptor subtype is selectively blocked by pyranzapine and used in treatment of peptic ulcer? So M1 receptor located in the gastric gland, M2 receptors heart, M3 receptors glands and smooth muscles, and all of these. So especially pyranzapine, telanzapine, selective M1 receptor blocker helps in the treatment of ulcer, peptic ulcer. Answer is option A. M1 receptor selectively blocked by pyranzapine and telanzapine. So pyranzapine, telanzapine are antagonist selectively blocks M1 receptors in the gastric gland, helps in the treatment of ulcer, peptic ulcer. Okay, next question. Which one of the following drug is a selective beta 3 adrenergic receptor agonist used in overactive bladder? Overactive bladder is because of excess parasympathetic nervous system function. Because parasympathetic nervous system function releases acetylcholine, that acetylcholine generally causes contraction of urinary bladder smooth muscle. But excess release of acetylcholine may increases excess contraction of urinary bladder and may lead to over-functioning of urinary bladder and increases frequency of urination more than the usual. So like 𝘈𝙈𝑃ℎ selective type 3 muscarinic receptor blocker on urinary bladder, mirabegron, oxybutynine, solifenacin. Solifenacin, oxybutynine, 𝘈𝙈𝑃ℎ, they block type 3 muscarinic receptors on urinary bladder through parasympathetic nervous system. And here mirabegron selective beta 3 receptor agonist in the urinary bladder. So helps in the treatment of over-functioning bladder by relaxing the urinary bladder smooth muscle, reduces excess stimulation of urinary bladder smooth muscle. So that's why in our live class also I'm telling clearly that. So you have to first to go through the basics. Both parasympathetic, sympathetic exist on the all tissues, but both are having opposite action. Parasympathetic increases urination, sympathetic decreases urination. Answer is option B. So there are Mirabegron is selective beta 3 receptor agonist, reduces excess stimulation of over bladder, nothing but urinary bladder. Okay, next. Which of the following drug is a selective alpha 1A antagonist used in benign prostatic hyperplasia with minimal effect on the blood pressure? Prazosin, terazosin, alfuzosin, tamsulosin. Prazosin, terazosin, alfuzosin, they act on alpha 1 as well as alpha 1 subtype. Okay. And tamsulosin selectively blocks on alpha 1A present on the prostate gland. So, tamsulosin selectively block alpha 1A receptor present on the prostate gland and helps in the treatment of benign prostatic hyperplasia. Because excess stimulation of alpha 1A receptors on prostate gland may increase abnormal growth of prostate gland and may develop a benign tumor, benign prostatic hyperplasia. For treatment of benign prostatic hyperplasia, tamsulosin will be the drug of choice. Tamsulosin will be the drug of choice because tamsulosin selectively block alpha 1A receptor. If the person is suffering from hypertension plus benign prostatic hypertension, then drug of choice will goes to which one? Zosins. If only suffering from benign prostatic hyperplasia, the drug of choice will goes to tamsulosin. Tamsulosin selectively block all 1A receptors present on the prostate gland. So this is the explanation. So tamsulosin uroselective selectively block alpha 1A or alpha 1D subtypes. Next. Here, match the cholinergic drugs with their primary site of action. Hemicolinium. Okay. 𝙂𝙗𝐼𝙗, botulinum toxin, neostigmine, inhibit storage of acetylcholine into vesicles, inhibit the choline uptake into cholinergic neurons. Botulinum toxin, inhibit acetylcholine from vesicles. Neostigmine, inhibit acetylcholine esterase enzyme. So you can clearly know that. So neostigmine inhibits acetylcholine esterase enzyme. So S4. Where there is S4, S4 is here only. So in the option D only, there is S4. In the previous weekly test of pharmacology also I explained clearly. So please go through the options. Sometimes the exact answer given in the one option only. So that may be yes or whatever it may be. So clearly what I my intention. So S neostigmine. Neostigmine inhibit the acetylcholine esterase, that is correct, and S4 already present here. And the botulinum toxin inhibit the release of acetylcholine from the vesicles. S. Botulinum toxin inhibit the release of acetylcholine from presynaptic to postsynaptic cholinergic neurons. And 𝙂𝙗𝐼𝙗 inhibits storage of acetylcholine into the vesicles. Once acetylcholine is considered, that acetylcholine should be stored in the synaptic vesicle. So the storage of acetylcholine into the synaptic vesicles, the vesicular storage of acetylcholine into synaptic vesicles, the presynaptic cholinergic neuron inhibit by 𝙂𝙗𝐼𝙗. 𝙂𝙗𝐼𝙗 inhibit vesicular uptake of acetylcholine into synaptic vesicle and it promote the degradation of acetylcholine. And hemicolinium inhibit the choline reuptake into cholinergic neurons by that decrease acetylcholine synthesis. So, if there is a no reuptake of choline, there is a no resynthesis of acetylcholine. Okay, I hope you know the answer clearly. S4 and option D is the correct answer. Option D is the correct answer. Okay. Next. Next MCQ. Which of the following drug is associated with the floppy iris syndrome during cataract surgery? During the cataract surgery. So, which of the following drug is associated with the floppy iris syndrome during cataract surgery? So, options are prazosin, propranolol, tamsulosin, as well as atropine. So, the answer is simply clearly here tamsulosin. Which of the following drug is associated with the flappy iris syndrome during cataract surgery? And tamsulosin is a selective alpha 1 receptor blocker. Selective alpha 1 receptor blocker. It is also drug of choice for benign prostatic hyperplasia. Benign prostatic hyperplasia. So alpha 1 blocker with higher activity on alpha 1A, alpha 1D receptors than alpha 1B subtype. Tamsulosin and silodosin may cause floppy iris syndrome during cataract surgery. Surgery. Next. So, going through the next MCQ. So, regarding the next MCQ, one of the following statement with respect to pilocarpine is not correct identified. Pilocarpine not correct identified. So, pilocarpine is an alkaloid obtained from the leaves of Pilocarpus microphyllus. That is correct. Pilocarpine is a tertiary amine, crosses blood-brain barrier and can cause CNS side effects. Pilocarpine cannot be used in xerostoma, and pilocarpine is used as a cialog. Pilocarpine is used as a cialog. Generally, pilocarpine can be used in xerostomia. Xerostomia nothing but a dry mouth. Pilocarpine salivary gland and pilocarpine by stimulating salivary gland, it may make a dry mouth to wet mouth. So generally used in xerostoma, but here they mention not used in xerostoma. So option C is correct. Remaining three options are option C is incorrect. Remaining three options are correct. So answer is simply option C is the wrong answer about the pilocarpine. Pilocarpine used in xerostoma dry mouth. Xerostoma dry mouth. So it is natural alkaloid and it is containing imidazole basic nucleus. Imidazole containing alkaloid biosynthesis from the histidine. Next. So next they gave the information regarding the 𝘂𝙎𝙎𝙎𝙄𝙎. So following are the facts regarding 𝘂𝙎𝙎𝙎. Identify the false statement. So oxygen relatively selective for M3 as well as M1 with less action on M2 subtype. Because of vesicoselective action, it is not used for tetracer instability resulting in urinary frequency and Rs incontinence. Oxybutynin is metabolized by CYP3A4. Anticholinergic side effects are common after oral dosing. So here they gave that identify the false statement. So generally it is a vasoselective. Because of vasoselective only, it is used for the tetracer instability resulting in the urinary frequency and the Rs incontinence. So because of vasoselective action, it is used, but they mention not used. It is used in the urinary urgency as well as urinary frequency because of excess parasympathetic stimulation on urinary bladder. Excess parasympathetic stimulation of urinary bladder increasing the function of urinary bladder more than usual and feel to the patient discomfort. So option B is the answer here. Option B is the answer here. That is a false statement. False statement is option B. Okay. Next. Following are the facts regarding reversible anticholine esterases. Identify the false statement. Identify the false statement. Identify the false statement. So, reversible anticholineesterases inhibit both true and pseudocholine esterase reversibly. Useful in the management of post-operative urinary retention and paralytic ileus. Reversible anticholinesterase are physostigmine hydrophonium ecothiopate employed in the treatment of glaucoma, Alzheimer's disease, and belladonna poisoning. So, following are the facts regarding reversible anticholinesterase, identify the false statement. For example, yes, reversible anticholinesterase inhibit both true as well as pseudocholinesterases. So, true cholinesterase also known as acetylcholinesterase, pseudo also known as butyryl cholinesterase and useful in the management of post-operative urinary retention and paralytic release. Yes. And clearly, if you observe, they mention ecothiopate. Ecothiopate is a organophosphorus compound, irreversible acetylcholine esterase inhibitor. Irreversible acetylcholine esterase inhibitors and reversible anticholine esterase or acetylcholine esterase inhibitors. They help in treatment of Alzheimer's, belladonna poisoning also, as well as glaucoma also. I hope you know the answer clearly. So, ecothiopate is a irreversible choline esterase inhibitor, not a reversible. The answer is here simply option C because ecothiopate is a irreversible anticholine esterase. Irreversible anticholine esterase. Next, this is the classification of anticholine esterases. Next. Match the alpha-adrenergic blocking drugs within their category classes. For example, beta-haloalkylamine, that is 𝘂𝙃𝙎𝙬𝙗, irreversible alpha-1, alpha-2 receptor blocker. Alpha-1 selective blockers like josin, terazosin, doxazosin, prazosin. So, josins containing a chemical in the quinazoline, the same quinazoline ring present in the natural alkaloid Wasaka, natural alkaloid Wasaka. Then coming to non-selective blockers. So non-selective blockers like phentolamine, reversible non-selective blocker, and alpha-2 selective blocker, yohimbine. Alpha-2 selective blocker, yohimbine. I hope you know the answer clearly. So answer is option C, that is P for 𝘂𝙃𝙎𝙬𝙗 and Q2 that is prazosin and R1 phentolamine and alpha-2 selective blocker yohimbine. Alpha-2 selective blocker yohimbine. So this is a classification of alpha receptor blockers along with reversible as well as irreversible category, including selective as well as non-selective. Next. Next continuation of match the following type of autonomic ganglionic drugs with their categories. Okay. So here non-selective or muscarinic agonist. So generally acetylcholine here it is a muscarinic agonist or parasympathetic. Monosulfonine compound. Generally trimetaphin camphor sulfonate it is a monosulfonine chemically and quaternary ammonium compound. Pentolinium, onium, ammonium, quaternary ammonium compound and amine nathemata pempidine. So here simply monosulfonine compound is trimetaphin camphor sulfonate and non-selective generally it is a acetylcholine. Acetylcholine non-selective one it acts on muscarinic receptor as well as a nicotinic receptor. So by this you can understand the answer is option B. Answer is option B. Okay. So this is the classification of ganglionic blockers. Ganglionic blockers as well as a ganglionic stimulant. They stimulate N-nicotinic receptors. N-nicotinic receptors. Next, match the following cholinergic receptors types with their major locations. So N-nicotinic ganglion present on the adrenal medulla. M1 receptors present on the gastric glands. NM receptors present on the neuromuscular junction. M3 receptors present in the bronchi. So you know that. So here there is inclusion of muscarinic receptors as well as nicotinic receptor. Type 3 muscarinic receptor present on all smooth muscles and all glands. So all smooth muscles stimulated in presence of acetylcholine except the blood vessel because there is a release of nitric oxide, a vasodilator. All types of M3 receptors in presence of acetylcholine stimulate the glands, produce secretions. So this is the easy one. You can easily answer. within short time. The answer is according to our choosing option A. Option A is the answer. So receptors are like formulas for the pharmacology. So must to go through the receptors basics. So NN receptor, NM along with their location, muscarinic, nicotinic receptor. Muscarinic receptors are G-protein couple. Nicotinic receptors are ion channel receptors. Nicotinic receptors are ion channel receptors. Next, anticholinesterases are contraindicated in which of the following conditions? So anticholinesterase is nothing but acetylcholine esterase enzyme inhibitors not suitable in following condition. Contraindicated. Don't use in particular condition. So hypotensive state. So anticholinesterase is nothing but ultimately they increase acetylcholine by inhibit acetylcholine esterase enzyme. So increasing acetylcholine. Okay. So hypotensive state, so AV conduction defective, sick sinus syndrome, post-operative decurarization. So the contraindication will goes to the post-operative decurarization. Post-operative decurarization. So in this condition, this anticholinesterases are should not be useful. So curarization atimata D2O-curarin. Curarin atimata D2O-curarin, a neuromuscular blocker acts on skeletal muscle by blocking nicotinic muscle receptors. The answer is simply option D. Next. Which of the following statement regarding prazosin are true? Regarding prazosin are true. So prazosin is a selective. Prazosin is a selective alpha receptor block. Alpha receptor are located on the brain, and prozosins are selective alpha 1 blocker help in the treatment of severe hypertension. So prazosin is potent, highly selective receptor. Yes, that's correct. Simple. Potent at low dose produce action. High action. Prazosin block alpha 1 receptor bladder trigone and prostatic smooth muscle, thereby improve urine flow, reduces residual urine in bladder. Prazosin is effective orally, bioavailability more than 6% around, highly bound to plasma proteins, managed in the liver and excreted primarily in the bile. Prazosin is not used in Raynaud's disease and benign hypertrophy of prostate. Benign hypertrophy of prostate. So here all are correct. Like P is correct, Q is correct, R is correct. But prazosin used in Raynaud's disease and benign hypertrophy of prostate. It is used in the benign prostatic hyperplasia as well as Raynaud's disease. What is Raynaud's disease? Due to excess vasoconstriction, there is a decrease in blood supply to end part of the body. There are end parts of the body. That is the Raynaud's disease. In that condition, these alpha blockers are useful. Alpha blockers are useful. So that is simply, so remove the option S and PQR is the correct. PQR is the correct. Next. So these questions are little bit lengthy. So be patient and go through the explanation by pausing the video. Next. Regarding the next MCQ. Consider the following statement regarding the clinical use of alpha blockers. Clinical use of alpha blockers. Prazosin is useful treating benign prostatic hyperplasia. Okay. Phentolamine used in hypertensive crisis due to chloride withdrawal. So chloride is a selective alpha 2 receptor agonist and generally suddenly stopping the use of chloride leads to reflex increase in hypertension. So to control that reflex increase in hypertension, phentolamine is useful because phentolamine is a non-selective reversible alpha 1 alpha 2 receptor. So this is wrong. So generally, I think here it is phenoxybenzoamine. Phenoxybenzoamine is a drug helps in treatment of pheochromocytoma to block alpha receptors. Phentolamine can be used to treat male sexual dysfunction. Male sexual dysfunction. So here all are correct. So PQRS. So prazosin, all this what the option mentioned here, all options are correct regarding this statement regarding this MCQ. Answer is the option D. Once you go through the explanation by passing your video. Next, select the pressor agent from the adnergic drugs listed below. Pressor, vasopressor. Vaso means blood vessel. Pressure means rising pressure, increasing pressure on blood vessel. So 𝙂𝙎𝘾𝙄𝑖𝑎, it is a beta 2 receptor agonist, relax the uterus. 𝙂𝙄𝑃 beta 1 receptor selective agonist. 𝘂𝑎mphetamine a CNS stimulant and mixed acting, indirectly acting sympathomimetic. And mephentermine. Mephentermine among this option is regarded as vasopressor. It increases the pressure on blood vessel by constricting the blood vessel. Vasopressors, increasing pressure on blood vessel. Vasopressors like noradrenaline. The question is very easy. The answer also easy to track it. So this is regarding the answer is option D, and this is regarding explanation. So pressor agent noradrenaline, ephedrine, dopamine, phenylephrine, methoxamine, mephentermine. Next. Which of the following is rate limiting step in biosynthesis of catecholamines? Biosynthesis of catecholamines. I hope you know that catecholamines nothing adrenaline, noradrenaline, dopamine. These catecholamines are biosynthesized and they helps in the functions of a sympathetic nervous system. So conversion of dopa to dopamine by dopa decarboxylase. Conversion of tyrosine to L-dopa by tyrosine hydroxylase. Conversion of dopamine to noradrenaline by dopamine beta hydroxylase. Conversion of noradrenaline to adrenaline by N-methyl transferase. I hope you know that conversion of tyrosine to L-dopa is a rate limiting step. Once this step is crossed, so dopamine will be produced and further noradrenaline will produce. And this noradrenaline enters into the adrenal gland, adrenal medulla, and noradrenaline converts to adrenaline. So the rate limiting step is conversion of tyrosine to L-dopa. Is the answer B is the correct answer. This is the rate limiting step. Once this step is completed, catecholamine synthesis will happen. And this rate limiting step can be inhibited by the one of the drug metyrosine. Methyl form of tyrosine, metyrosine inhibit conversion of tyrosine to L-dopa and prevent rate limiting step in the catecholamine biosynthesis. So isoprenaline, aline similar to adrenaline, but compared with adrenaline, extra propyl group, extra isoprenaline similar to adrenaline. So it acts on following receptors: alpha 1, alpha 2, beta 2, alpha 1, alpha 2, beta 1, beta 2, alpha 1, alpha 2, beta 1. It is mainly acts on the adrenergic beta receptors only because of its isopropyl group. Due to increasing chain length, if chain length increases in the sympathomimetics, it having more affinity towards beta receptors only. Isoprenaline highly selective on beta adrenergic receptors only, not on alpha adrenergic receptors. Answer is option D. Okay. Next. So let's have a discussion on the next MCQ. So what is the next MCQ? So which of the following statement regarding estazolamide are correct? Estazolamide is generally a carbonic anhydrase inhibitors. Let's have a look on this. So estazolamide is sulfonamide derivative. It is a carbonic anhydrase inhibitor. Okay. Oral treatment with estazolamide reduces aqueous humor formation by limiting the generation of bicarbonate ion in the ciliary epithelium. It is used to supplement ocular hypotensive drugs for short-term indication. And paresthesia, anorexia, acidosis are not side effect of the estazolamide. So generally, option S will be the wrong. Generally, paresthesia, loss of sensations, anorexia, loss of appetite, acidosis, increasing acidic pH in the blood. These are the side effects of estazolamide. So remove the option. Option S is the incorrect. Option S is the incorrect. So all of the above also remove the option, and option S is here, that is also removed, and only here QR mentioned. Generally PQR is the correct. So option C is the correct answer. Option C is the correct answer. Option C, correct answer. And 𝑎 also used as a diarrhea. Sorry, also used as a diabetic. Also used as a diabetic. Next. So here, drug matched correct mechanism of action. So timolol decreases aqueous secretion, pilocarpine decreases trabecular outflow, latanoprost decreases production of aqueous humor, brimonidine increases trabecular outflow. Generally, is a non-selective beta blocker. What it will do generally, it helps in the treatment of glaucoma by decreased aqueous humor secretion. Pilocarpine is a myotic, constrict the pupil of eye, remove excess fluid from inside of the eye to outside of the eye. So pilocarpine increases, and latanoprost also increase production of aqueous humor to outside of the eye, increase elimination. Brimonidine decreases, brimonidine also decreases trabecular outflow. So simply the answer is timolol. Timolol decreases aqueous secretion, decreases the aqueous humor formation. So here beta blockers, alpha 2 agonist, carbonic anhydrase inhibitors, increase aqueous outflow. This is a classification for drugs helps in the treatment of glaucoma. Next question. Regarding the next MCQ, which of the following is an advantage of topical beta blockers over myotics? So beta blockers are mydriatics, dilate the pupil of eye, mydriatic, and myotics are parasympathomimetics, they cause constriction of pupil of eye. Let's see the options. No change in pupil size, no vision, dim light, and impatient with cataract. Induced myopia, which helps in near vision in the young patients. No headache or brow pain due to persistent spasm of iris and ciliary muscle. Convenient twice or once daily application sufficient. Here they clearly asked the advantage of topical beta blockers like timolol over the myotics, except. So generally all these are common things. So induces myopia and helps in the near vision. Helps in the near vision. Option B is the correct regarding this. Beta blockers like mydriatics are advantage over myotics because of this option. B helps in the near vision. They does not affect the near vision in the patient with glaucoma. So these are the advantage of topical beta blockers over myotics. Next. So here in organophosphorus poisoning, pralidoxime used because pralidoxime chemical is a 2-gram pyridyl acetyl monoxime pralidoxime block muscarinic receptor, break the bond between acetylcholine esterase enzyme and organophosphorus compound and reactivate the acetylcholine esterase enzyme, prevent the acetylcholine release, inhibit the choline esterase even further. Generally, in the organophosphorus poisoning, there is a covalent bond formed between phosphate group of organophosphorus compound and a serine group of acetylcholine esterase enzyme. Because of this inactivation of acetylcholine esterase enzyme, severe increase in acetylcholine levels in the blood. So that's why pralidoxime used to reactivate the acetylcholine esterase enzyme. This reactivated acetylcholine esterase enzyme rapidly, immediately metabolize all excess acetylcholine in the body and helps in the treatment of reducing the symptoms of organophosphorus poisoning. Answer is option B. Next. Which of the following effect is mediated by stimulation of muscarinic receptors in the heart? Increased sinoatrial node firing, enhanced AV nodal conduction, increased potassium conductance hyperpolarization, increased calcium influx in the ventricles. Generally, when acetylcholine or parasympathetic nervous system acts through M2 receptors on heart, it leads to decreasing calcium concentration in heart and leads to increasing efflux of potassium from the heart muscle. So because of this, no calcium, no potassium, no sodium in the cardiac muscle. In this condition, there is an increasing negative voltage that develops hyperpolarization, relaxation of cardiac. Relaxation of cardiac muscle is the effect observed with the activation of M2 receptors under parasympathetic system. Option the answer. Option C is the answer. Next. Which of the following is a ganglionic blocker that blocks both sympathetic and parasympathetic ganglia? So atropine is only blocks muscarinic receptor. Hexamethonium a ganglion blocker. Tubocularin only block NM receptor, nicotinic muscle receptors. Pancuronium also block nicotinic muscle receptors. So which of the following ganglionic blocker? Hexamethonium is a ganglionic blocker. Onium, quaternary ammonium compound. Mostly ganglion blockers are quaternary ammonium compound. Quaternary ammonium compounds are having poor absorption distribution because of cation nature, that's what polar nature. So unable to central barrier. B. Hexamethonium. Next. Which receptor subtype is predominant in the vascular smooth muscle and mediates vasoconstriction when stimulated? So, which receptor subtype is predominant in the vascular smooth muscle and mediates vasoconstriction when stimulated? I hope you know that. So, generally, alpha 1 receptors located on the blood vessel, stimulation of alpha 1 receptor vasoconstriction. Alpha 2 receptors in the CNS, stimulation of alpha 2 receptor, decrease the release of noradrenaline from central to peripheral, decrease pressure, beta 1 on heart, beta 2 on lungs, bronchoscopic muscle. So simple here, alpha 1 receptor present on the blood vessel, stimulation of alpha 1 receptor produces effect as a vasoconstriction, constriction of smooth muscle on the blood vessel increases blood pressure. Excess stimulation of alpha 1 receptor, severe hypertension. That severe hypertension can be treated by selective alpha 1 blockers like a 𝘂𝙎𝙎𝘾. Selective alpha 1 blockers like a 𝘂𝙎𝙎𝘾. Next, again coming to the following questions. Regarding the match the following questions. So here nebivolol, okay, nebivolol, carvedilol, pindolol, propranolol. So propranolol is a non-selective beta blocker. Propranolol is a non-selective beta blocker. So general nebivolol will be the cardioselective and carvedilol will be the non-selective beta blocker as well as an alpha blocker, and propranolol will be the non-selective beta blocker without intrinsic sympathogenic activity, and pindolol will be the non-selective beta blocker with the intrinsic sympathogenic activity. Answer is option C. Answer is option C. Regarding the match the following from sympathetic nervous system question. Answer is option C. So simply P nebivolol cardioselective beta 1 and Q4 carvedilol mixed alpha plus beta blocker, and R pindolol that is non-selective beta blocker with intrinsic sympathomimetic activity, and propranolol non-selective beta blocker with without intrinsic sympathomimetic activity. So this is the classification regarding alpha plus beta blocker. Next, which of following cholinesterase inhibitors have central and peripheral effects? So like neostigmine, pyridostigmine, physostigmine, none of them. So which are the following cholinesterase inhibitors? So nothing but they inhibit the acetylcholinesterase enzyme in the peripheral as well as the central. And we have to clearly observe neostigmine is a quaternary ammonium compound, so unable to cross central blood-brain barrier. Pyridostigmine also quaternary ammonium compound. Physostigmine is a tertiary amine. Tertiary amines are lipophilic in nature. They can easily cross the blood-brain barrier. So here our physostigmine is a natural alkaloid. It is a tertiary amine, and tertiary is also blood-brain barrier. It alkaloid enzyme in the CNS as well as a peripheral also. Answer is option C. Physostigmine inhibitor acetylcholinesterase enzyme in both peripheral as well as a central. Next, which of the following is correct about physostigmine? It is a tertiary ammonium compound. Yes. It is poorly absorbed from the intestine. No, it is wrong. It does not cross the blood-brain barrier. It can cross the blood-brain barrier, and it is used in the curare poisoning. Which of the following is correct? It is a tertiary amine. Which of the following is correct? It is the tertiary ammonium compound. Okay, correct. Poorly absorption. No, it having good absorption. It does not cross blood-brain barrier. It readily cross the blood-brain barrier. It is used in curare poisoning. Generally, it is not preferred in the curare poisoning. So the correct one is simply option A. It is a tertiary ammonium compound, can easily cross the blood-brain barrier, having good absorption as well as a distribution. And generally, physostigmine used in the atropine poisoning, overdose of atropine, neostigmine used in the curare poisoning, 𝘂𝙁𝙁, a neuromuscular blocker. Excess dose of 𝘂𝙁𝙁 may produce skeletal muscle relaxation or paralysis of skeletal muscle. To prevent a overdose of that curare poisoning, neostigmine will be the drug of choice. Neostigmine will be the drug of choice. Next question. Which of the following topical agent in glaucoma acts by blocking beta receptors in the ciliary epithelium to reduce aqueous humor formation? So they asked topical agents in glaucoma acts by blocking beta receptors. So what it may be, first study the question clearly. So in the question itself, in any word, you will get answer. Beta receptors blockers. Here, epinephrine nothing but adrenaline. It is a sympathetic stimulate alpha as well as beta receptor agonist. Carbonic anhydrase inhibitor does not have function of beta receptor. Pilocarpine, parasympathetic myotic, constrict the pupil of eye, acts on muscarinic receptor. So timolol is a non-selective beta blocker. Apply topical, reduce the aqueous humor formation, helps in the treatment of glaucoma. Helps in the treatment of glaucoma. Answer is very simple. Timolol. Regarding the timolol, the same question they asked in the 2020 GPAT question paper. Next. Which alpha-adrenergic agonist used in glaucoma work by reducing aqueous humor production and increasing uveo-spiral outflow? So phenylephrine, selective alpha-1 receptor agonist, brimonidine, prazosin, selective alpha-1 receptor blocker, isoproterenol, it is also comes under the sympathomimetics category. So brimonidine is a alpha-adrenergic agonist, especially alpha-1 receptor, helps in the treatment of glaucoma by reducing aqueous humor production and increasing uveo-spiral outflow. Increases outflow of excess aqueous humor from inside of the eye to outside of the eye through uveo-sclera. Answer is brimonidine. Here it is a classification regarding topical drugs in treatment of glaucoma. So here this table will help you to understand what exactly this category of drugs doing in treatment of glaucoma. So make a screenshot. Next question. So which of the following is true about 𝘂𝙁𝙎𝙁? 𝘂𝙁𝙎𝙁 generally is the only organophosphorus compound irreversibly inhibit acetylcholine estradiol, helps in the treatment of a glaucoma. Helps in the treatment of a glaucoma. So it is generally reversible inhibitor of acetylcholine estradiol. No, it can cause cataract formation. It is a beta blocker. No, it does not cross the cornea. It does not cross the cornea. So which of the following is true? Regarding the true information of this drug, it can cause cataract formation. It can cause the cataract formation, and remaining option A, option C, option D are wrong. And the true one is the option B. 𝘂𝙁𝙎𝙁 can cause cataract. Can cause cataract. Next. So next, which of the following statement regarding ipratropine bromide are true? I hope you know ipratropine bromide is a semi-synthetic derivative. It is a semi-synthetic derivative, helps in the treatment of COPD by selectively blocking type 3 muscarinic receptors in the bronchial smooth muscle. So true statement. Ipratropium bromide selectively on bronchial muscle without altering volume or consistency of respiratory secretions. Consistency. It has gradual onset and a late peak at 40 to 60 minutes of bronchodilator effect. Ipratropium is more effective in bronchial asthma than COPD. It is more effective in COPD than asthma treatment, and action is about 4 to 6 hours. So they're asking the true statement. Regarding the true statement, so generally PQS, PQS are true. Option R is false because ipratropium is more effective in treatment of COPD than asthma. But they mention this drug is effective in treatment of asthma than COPD. So remove the option R. Remaining PQS are correct. PQS are correct. B is the correct answer. Next. The mechanism of action of pyridostigmine involves which of the following? The mechanism of action of pyridostigmine involves following. So pyridostigmine nothing but a reversible acetylcholine esterase enzyme inhibitor. So direct stimulation of nicotinic receptor no. Inhibition of acetylcholine esterase enzyme nothing but it is a choline esterase enzyme inhibitor. Blocking muscarinic receptors no. Enhancing acetylcholine release no. So simply pyridostigmine like physostigmine, neostigmine, it generally inhibit the acetylcholine esterase enzyme and increase the acetylcholine levels by decreasing the inactivation or metabolism of acetylcholine. Inhibit the acetylcholine esterase enzyme. That is general mechanism of pyridostigmine. General mechanism of pyridostigmine. Next, which of the reversible acid inhibitor lipid soluble barrier? The blood-brain barrier. So neostigmine quaternary ammonium compound, no blood-brain barrier crossing. Pyridostigmine, no. Physostigmine, tertiary S. Hydrophonium, it is also diagnostic agent generally. It also does not cross blood-brain barrier. So here they simply mention cross the blood-brain barrier. Physostigmine is a natural alkaloid can cross the blood-brain barrier. It is a acetylcholine esterase enzyme inhibitor. So here lipid soluble, water soluble, and generally lipid soluble only can cross the blood-brain barrier. What not water soluble, not polar substance. Next question. Consider the following statement about sympathomimetic drugs. Direct sympathomimetics act by binding directly to alpha as well as beta adrenergic receptors. Yes, directly sympathomimetics means they directly interact with alpha beta receptor and show sympathomimetic action. Isoprenaline. Isoprenaline is selective alpha adrenergic agonist. No, isoprenaline is highly selective towards beta adrenergic receptors. No action on alpha receptor, especially because of its isopropyl group in its structure. So it containing a isopropyl. Isoprenaline, similar action like adrenaline, but due to isopropyl group in the isoprenaline, it having only affinity towards beta receptors, no affinity on the alpha receptor. Indirectly, sympathomimetics like amphetamine acts by releasing noradrenaline from the presynaptic S. Ephedrine, both the direct as well as indirect action. Simple logic. Ephedrine is a mixed acting sympathomimetic. So isoprenaline is selective on alpha, that is the wrong one. And PRS are right. PRS are right. So I hope you understand. Option A is the correct one. Option A is the correct one because option Q, isoprenaline is highly selective on the alpha receptors, so beta receptors only, but not alpha receptors. Option Q is incorrect. Remaining option P or S are correct about sympathomimetics regarding this question. Regarding this question. Okay. Next question. Regarding the next MCQ, which of the following statement about catecholamines are true? Catecholamines are synthesized from the amino acid phenylalanine. Adenine and dopamine are examples of endogenous catecholamines. Phenylephrine, tyramine, amphetamine are examples of non-catecholamines. Noradrenaline is a exogenous catecholamine. Even noradrenaline also endogenous, sensed in the body only, but they mention exogenous. Noradrenaline is not an exogenous. Noradrenaline is not an exogenous. So here also simply PQ are correct. Here also simply PQ are correct. So here the S is incorrect because noradrenaline also endogenous catecholamine. It is inside in the body, but it is not an exogenous. It is not an exogenous. Next, which of the following statement about hydrophonium is true? Long-acting lipid-soluble carbamate cholinesterase inhibitor used in long-term treatment of myasthenia gravis. It is a short-acting water-soluble drug used for diagnosis of myasthenia gravis. It irreversibly inhibits the acetylcholinesterase enzyme by carbamylation. So it is not an irreversible. It is a reversible acetylcholinesterase inhibitor. Remove this. It is used in long-term treatment of myasthenia gravis. No, it is a long-acting lipid soluble. It is a water soluble. So hydrophonium is a short-acting water soluble used for diagnosis of myasthenia gravis. Used for the diagnosis of gravis. So answer is simply option C. Next, regarding the next MCQ. Consider the following statement regarding rivastigmine. Rivastigmine is a long-acting carbamide that selectively inhibits the acetylcholinesterase enzyme in the brain. It is highly lipid-soluble cross the blood-brain barrier. Rivastigmine not used in the treatment of Parkinson's disease. It is used in the treatment of mild to moderate Alzheimer's disease. Okay, so this is regarding the information about rivastigmine. So it is used in treatment of mild to moderate Alzheimer's. Yes, it is a drug of choice for treatment of Alzheimer's along with other parasymptomatics, especially inhibits acetylcholinesterase in the brain. And rivastigmine not used in treatment of Parkinsonism. It is not directly for treatment, but this rivastigmine along with other drug may also help in treatment of Parkinson's disease. And it is highly lipid soluble and pancreas, yes, correct. And it is a long acting drug. So here simply it is not used in treatment of Parkinson's. Generally, it is also used and simply remove the option R. PQS correct. PQS are correct. R is incorrect. R is incorrect. Option A is the answer. Option A is the answer. Next. Consider the following statement regarding Tacrine. Tacrine is a first clinically successful drug for treatment of Alzheimer's disease. Nowadays, it is not using because of its adverse effect as a hepatotoxicity. Adverse effect as a hepatotoxicity. So, tacrine is a lipophilic eccridim compound which interacts with the cholinesterase enzyme in a manner analogous to hydrophonium. Cross the blood-brain barrier has a long duration. Tacrine associated with hepatotoxicity, GI side effects like diarrhea. Tacrine is a centrally acting cholinesterase inhibitor, enhances cholinergic transmission in the brain. Enhances cholinergic transmission in the brain. So here simply, yes, the all are correct like PQRS. So all four statements mentioned here are correct about the tacrine. Correct about the tacrine. So the simply answer is PQRS are correct. So PQR is mentioned in the option B. Option B mentioned in the PQRS. Next question. Regarding the next question, which of the following statement regarding propranolol is It is contraindicated in bronchial asthma due to risk of life-threatening bronchospasm. Yes, correct. Don't take propranolol in asthma patient. Competitively block alpha-mediated action of catecholamines and other adrenergic agonists. Yes, it block catecholamines function on alpha as well as beta receptor because propranolol is a beta receptor blocker. It is preferred in patient with complete heart block. No, patient is having heart block. This drug is not preferred. It may increase the severe risk of heart block. It can be increase the risk of 𝙂𝙀𝙎𝙀𝙍 in diabetes patient. So in diabetes patient, don't take beta blockers because blocking of beta receptors decrease the glucose production. Stimulation of beta receptors increase the glucose production. Increase the glucose production. So simply option R. You have to remove option R because propranolol not preferred in the patient with a complete heart block. Answer is option A. PQS correct. R is incorrect. Propranolol not suitable in a patient with a decreasing heart function, failure of heart function. Next. Which of the following statement regarding atropine are correct? Atropine can be used as a pre-anesthetic medication. Yes. A common adverse effect of atropine, urinary retention. Yes. Parasymptolytic. Atropine useful in treating delayed onset mushroom poisoning. No. Bradycardia is a possible adverse effect of atropine. Generally, atropine is a parasymptolytic produced tachycardia, and atropine used in the immediate onset mushroom poisoning, not delayed onset mushroom poisoning. Generally, here the PQ are correct. PQ are correct. That is simply the answer for this question is option A. Atropine used as a pre-anesthetic medication. A common adverse effect of atropine, urinary retention. 𝑎𝑐𝑡ylcholine increase urine output. Atropine parasymptolytic decrease urine output. Answer is option A. And this is a trick. Clinical applications of atropine as atropa. And this is a trick to remember adverse effect of atropine in the form of pitta 𝘖𝙗𝑎. Make a screenshot. Next, last question of our part of ANS MCQ discussion. Match the following condition with the drug of choice. So, carbamate and organophosphates, belladonna, motion sickness, curare poisoning. So, regarding the motion sickness, the option will go to the scopolamine, natural alkaloid. Regarding the curare poisoning, neostigmine will be there. And regarding belladonna and datura atropine poisoning, physostigmine will be there. Regarding carbamate and organophosphorus poisoning, atropine will be there. Atropine will be there. So along with our explanation, the option will goes to that answer. So P carbamate and organophosphorus, atropine, and Q1 belladonna and datura poisoning, physostigmine. Motion sickness, scopolamine, also known as hyoscine, L-isomer, and curare poisoning is a neostigmine. Neostigmine, a quaternary ammonium compound, polar in nature, cannot cross the blood-brain barrier. Okay. So curare poisoning, neostigmine will be the drug of choice. Atropine drug of choice for carbamate and organophosphorus poisoning. Physostigmine drug of choice for belladonna as well as datura, atropine poisoning. Okay. So this is regarding our explanation of autonomic nervous system MCQs of today. I hope you performed well and you got the right answers. If you having anything is there, let me comment in the comment box and definitely I will rectify it. Thank you. So believe in yourself and focus on your preparation and don't forget why you joined in the GDC. All the best.